I'm here with Dr Andrew Meyerson, who's a junior doctor at Homerton Hospital. We're here on the picket line. Andrew, why are you striking today?
We are here today because there is a massive crisis in the NHS for both us as NHS staff and also for you as NHS patients. You are facing the longest waiting list in NHS history. It is 7.4 million people long. Patients are waiting longer than ever before to see their GP, to be seen in A&E, to get cancer care, to get outpatient care, and it is unacceptable here in the sixth wealthiest country on the planet. 10 years ago, this was not the case. 10 years ago, the NHS was functioning. We were the number one healthcare system on the planet, ranked number one by the Commonwealth Fund. And then look what this government's done to it. And in the last 10, 15 years, we have lost 32% of our pay. We're now seeing record staff suicide and staff mental illness. Record staff suicide, record mental illness among NHS staff. It is unsustainable. And so, after the worst crisis in NHS history that we're facing right now, this government does not want to do anything about it, does not want to have a plan to fix any of it. And when the government puts all of us into this position, it forces us to take this action because they refuse to listen otherwise. And so we didn't want to be here today, but this is an absolute necessity. The NHS will collapse further if we don't do this. If there are no doctors in this country because we've been driven to go abroad because we just can't afford to live here. We have over £100,000 in student debt. So many of us. We have registration fees after 15 years of losing massive amounts of our pay. Working conditions that are just frankly terrible. Record numbers of staff suicide and staff mental illness. It's becoming, it's a mess right now. And it is a mess that is entirely made and engineered by 13 years of conservative governments that do not care about patients, that do not care about staff. And that's why we're here today. Unfortunately, we wish that we were inside the hospital, continuing to care for patients like we're trained to do. But this government's put us in a position, this government's put patients in a position, frankly, holding patients hostage in this way because they're saying, okay, well, if you can't get an appointment with your GP, if you can't be seen in A&E quickly enough, if you can't get your cancer care, go and take out a private health insurance policy. That's what they want you to do. And they'll say, oh, it won't cost so much money, but of course it will. There's a reason why you don't have medical bankruptcy here in this country, because we have an NHS. Where I come from in the United States, 500,000 Americans declare bankruptcy every single year. And now in the States, 30 million of us don't even have health insurance. You guys have an extraordinary thing in the NHS, but we have a government for the last 13 years that has underfunded, undermined it, and driven it into the ground so that your care right now is absolutely unacceptable. Our care and our treatment in hospitals is absolutely unacceptable, and all of us suffer. And so that is why we're here fighting for us, fighting for our colleagues, fighting for our patients, and fighting for the NHS, because unless we fight for it right now, it will not survive, in 25 more years.
Absolutely, thank you. One more question.
Yes.
At the moment, we are seeing rail workers, teachers, Amazon workers, a number of others taking strike action as well. Do you see your fight connected with that in any way?
100%. We are absolutely connected to every other group of workers who have been undervalued and undermined by this government. With all of the other NHS workers that are on strike, to rail workers, to teachers, everybody that works in the public sector, we all deserve a pay rise. And this government's excuse that it will contribute to inflation, it's not true. We are 17% of the overall workforce. The London School of Economics confirmed that a public sector pay rise would not increase inflation. Look, they put us through austerity 1.0, told us we can't have a pay rise. They froze all of our wages. And, we saw what happened during austerity, 1.0, where 300,000 people died, and it destroyed a generation of people, while they actively destroyed the society in which we all live. And now we are firmly in austerity 2.0, and they're telling us once again that we can't have a pay rise, while, they have record profits for corporations right now. It is unacceptable while they profit, while we toil and, while we struggle in the way that we are. They can pay just a little bit more in taxes. It will not bankrupt them. It will not change their quality of life. but it will dramatically affect, our lives as working people in this country to make society just a little bit more fair. And that's not a radical thing to ask for. That's not a crazy thing to ask for. That's entirely appropriate. We need a system where children from all backgrounds can be educated, where people from all backgrounds can get to where they want to go and can be, done safely, and where people can be treated in hospitals in a safe way and can have a standard of care that they should demand and should expect here in the sixth wealthiest country on the planet. While this government does everything to destroy our society, workers right now are fighting back, and we're standing up for each other, because this is all a struggle that we are all in this in this together. And so, from all NHS staff members to all public sector workers, to our incredible colleagues at Amazon who are striking as well. We're in the same fight, and solidarity with each and every one of you guys who are continuing to fight, because this government refuses to listen, and this is the only way to make them listen and to stand up for each other and stand up for ourselves.
Absolutely. Thank you, and solidarity.
Thanks so much.